In this video, we'll discuss about cardiovascular system drugs, CVS drugs. Three chapter. In this one having three chapter, we will discuss one by one. First one is drugs affecting renin angiotensin system. Second one is drugs for heart failure. Third one is anti-hypertensive drugs. So cardiovascular system drugs, we have three chapter. First we will discuss drugs affecting renin angiotensin system, RAS. Okay, we all have blood pressure. It is having two component. One is systolic and diastolic. Systolic is always 120, diastolic is 80. This is the normal blood pressure. Plus or minus 10, 20. Okay, so normal blood pressure 120 by 80 due to any reason. Okay, due to any reason, if blood pressure fall down degrees, means say for example supine position suddenly uh, get up early in the morning, so we should not directly wake up, so all the blood will go to our lungs, so blood pressure may fall. Then some other reason, it may be because of vomiting or diarrhea or accidental blood loss or having surgery. Okay, surgery in which the blood is lost. Due to any reason, blood pressure fall. Okay, so what happen if the blood pressure fall? We can go in shock, we all can die. It is not happen in us because we have this one not happen because we have backup. So everywhere blood pressure fall in us. Okay, whenever decrease that blood pressure pp, that ras get activated, renin angiotensin system get activated. So whenever blood pressure fall, that time renin angiotensin system activated. That is the function of renin angiotensin system. It get activated in healthy people only. Okay, it will activated healthy people only within a second. It just activated. So suppose any person blood pressure is falling due to uh, any reason, it may be xyz. Okay, inside the blood vessels, so inside blood vessel there is a protein. We have protein which is presented in always. Okay, for all you and me, it is inactivate form. That name of that protein name is called as angiotensinogen. Okay, whenever blood pressure fall because of various reason, in blood vessels we have protein. That protein name is called as angiotensinogen. This one inactivate form. It is formed by the liver. Okay, it is synthesized in our liver, inactive form, presented in our blood. Okay, it is this protein, now it is presented in our blood but inactive form. But as soon as blood pressure fall, whenever our blood pressure decrease, all our organ are receiving the blood. Kidney also receive a fixed proportion of the blood. Kidney is most sensitive. Okay, so kidney is the most sensitive organ. Just blood from head to toe, all our organ are receiving less blood because that person blood pressure is less. So All of our organ from get head to toe, they are receiving less blood, but kidney is more sensitive one. As soon as the kidney receive less blood, inside the kidney there is a cell. Okay, that cell name is called as jecta glomerular cell, jecta glomerular G cell. They get activated. They just sense, they are the sensor. As soon as they sense that the blood is less as compared to normal, means blood pressure is fall, they just secrete enzyme. Okay, that enzyme name is called as renin. So they secreted enzyme, that secrete enzyme name is called renin, secreted in the blood. The name of that enzyme name is called as renin. So it is secreted into blood, that name is called as renin. Renin come from kidney. Okay, where it come from, come from kidney. So renin come in the blood only when the blood pressure will fall. When blood pressure fall, that time only it will come to our blood vessels, blood. So currently in our body, that angiotensinogen is present already, and angiotensinogen is present in active form. So but now blood renin. Okay, now when that renin will enter, this one it become okay, renin is not there because blood pressure is normal. Okay, normal means it won't come. Now when if that fall, blood pressure is fall, then kidney will sense it. Inside the kidney, that jg cell, okay, cell will sense it. They presence on efferent arterioles, and they will secrete a renin enzyme in the blood. So the where is the renin secretion? Efferent arterioles. What does this renin do? Renin converted angiotensinogen into angiotensin 1. Okay, this when it will reach to blood, that time only it will converted angiotensinogen into angiotensin 1. But the angiotensin 1 is not very active. Now in the lung there is another enzyme, name of that enzyme is ACE. Okay, angiotensin converting enzyme. ACE means angiotensin converting enzyme. It will converted this angiotensin 1 to angiotensin 2. Okay, it will converted to this angiotensin is the most important product. Now it will act on 6 organ. Okay, it will act on 6 organ. All the 6 organ having angiotensin receptor. So this one maintaining normal blood pressure. What are the 6 organ? So this is the thing. Whenever there is fall blood pressure, renin get activated in all. You can see these blood vessels. This one is the blood vessels. So in all of our blood there is a protein angiotensinogen. It is a protein which is synthesized by liver. Whenever the blood pressure will fall, at the time the enzyme renin will come in the blood. The renin will come from the kidney. Okay, it will come from that kidney. Renin converted angiotensin 1 to angiotensinogen into angiotensin 1. Now from the lungs another enzyme will come, that is called ACE. Okay, this one angiotensin converting enzyme. It will convert angiotensin 1 to angiotensin 2. So finally we have 3 protein and 2 enzyme. So what are the 3 protein? This angiotensinogen, then angiotensin 1 and angiotensin 2. These are the 3 protein. What are the enzyme? 2 enzyme. this renin, then angiotensin converting enzyme, two enzyme, totally five things is presented. So three protein, two enzyme. So three protein one by one they are formed, and we are having two enzyme. What is the name of enzyme? Renin secreted by kidney and ACE secreted by lungs. So this family is known as RAS. So RAS family having three protein and two enzyme. This family is known as RAS, renin angiotensinogen system. Totally five members. These five members will maintaining normal blood pressure. How it will maintain the most important member, how it will maintaining this angiotensin 2 is the important factor, it will maintaining normal blood pressure. How we want to discuss. So this angiotensin 2 is the important one. It will act on six organ. What are the six organ? In our blood vessels, it causes vasoconstriction. Blood vessels, it will causes vasoconstriction. So blood pressure will rise again that construction. Then second, it will act on heart. In the heart it will increases the rate of force, the increases the rate, force and contractility. So again the blood pressure will rise. It will act on blood vessels, causes vasoconstriction. Then it will act on heart, it will increases rate, force and contractility. Then it will act on adrenal. So it will act on adrenal, it will secrete aldosterone. Okay, it will secrete aldosterone, and aldosterone causes sodium and water retention. So it causes sodium and water retention. So it will increases the blood pressure. It will act on kidney. The kidney also do sodium water retention. Again it rises blood pressure. It act on the brain. Next organ, it act on the brain. In the brain it stimulate the posterior pituitary. Okay, it stimulate that posterior pituitary. There is increasing ADH secretion. So we have more thirst, so we feel thirsty, so we will drink water. So again blood pressure will rise because we are increasing that fluid, we are drinking water, and it will act the nerves, which nerve it will stimulate in it will not stimulate parasympathetic. Okay, it will not stimulate parasympathetic, it will stimulate that sympathetic stimulation. Okay, which nerves? Not sympathetic, it will stimulate sympathetic stimulation, that will rise blood pressure. So it will stimulate the sympathetic stimulation, that will raise the blood pressure. All these six organ there is a receptor. So all the organ having receptor, angiotensin receptor. Okay, all the organ having that receptor, that name is called as angiotensin receptor is presented here. 80 angiotensin receptor, here 80, here 80. So all the angiotensin receptor is going on its receptor. Okay, here this angiotensin will go and bind with this receptor. Okay, six organ having receptors. These blood vessels we having angiotensin 2, it will go and bind with this receptor and increasing the blood pressure. So the fall in blood pressure again become normal. Say for example, so angiotensin to go and bind with that six organ receptor and increasing blood pressure, then become that blood pressure become normal. Say for example, blood pressure a person having 90 by 70 means, so again it will become 120 by 80 because these six organ are acting. This is renin pathway, name is called as renin angiotensin pathway. Renin angiotensin pathway. So by using renin angiotensin pathway, it will maintaining normal blood pressure level. Then one more functions of ACE, angiotensin converting enzyme, from where the ACE is secrete. ACE is secreted from the lungs. So ACE is secreted from the lungs when the blood pressure will fall. But currently, what ACE is doing in our lung, currently our blood pressure is normal, but ACE is presented in our lungs. So what is the normal function of ACE? When the blood pressure will fall, it converted angiotensin 1 to 2, but currently our blood pressure is normal, so it we don't have angiotensin O, so we don't want this conversion. So ACE is not doing this conversion. So normally ACE do another function in our lungs. So in everyone lungs, in our lungs there is a metabolic, there is a metabolite. Okay, there is a metabolite which is formed by, okay, there is metabolites which is formed by bradykinin and substance B. It is a metabolic product, bradykinin and substance B. So ACE inhibitor degrade that metabolic product, because this bradykinin and substance B is causes cough, edema, it can causes itching, it can causes taste disturbance. So ACE just inactivate the bradykinin substance B, so we don't have edema, because in our lungs ACE is doing this function. So ACE doing double role. Whenever blood pressure is normal, so it will convert bradykinin substances into inactive product. Whenever blood pressure fall, at the time it will converted angiotensin 2. So ACE have double role. So what is the function? Two main functions of ACE. Okay, whenever blood pressure is normal, so it will converted bradykinin substances into inactive product. But whenever fall, blood pressure fall, at the time it converted angiotensin 2. So ACE have a double role. So up to this normal physiology. Okay, see this diagram. ACE, angiotensin converting enzyme. Okay, AGE role. Okay, see this role and see this role. This is the normal physiology. Maybe after a particular age, after 50 years, after 60 years, many of the people have hypertension. Why hypertension in such a common disease in an increased age? After 50 years, what happened in the body? So patient have the hypertension. What happened? Why we have RAS? Why we have RAS? That renin angiotensin system. Whenever blood pressure fall, it get activate at that time and normalize our blood pressure. Okay, normalize our blood pressure. This is the function of RAS. After 50 or 60 in old age, RAS become that renin angiotensin system become hyperactive. Okay, hyperactive. Even on normal blood pressure, it become active. The person blood pressure is normal. Age become more than 50, the person become old. At the time RAS, that renin angiotensin system, the person is normal currently, that blood pressure is normal after 50 years. In fact, on normal blood pressure, RAS will get activated. Okay, will get activated. If the rash will get activated on normal blood pressure, it will act on sixth organ. We know that sixth organ, it will rise that blood pressure. The person have hypertension, so it will act on this sixth organ, rash, so we get hypertension. So whenever we have low blood pressure and the rash get activate, the rash to the blood pressure normalization, it will increase that blood pressure and do it normal. But if the blood pressure is already normal, okay, now already normal, and that rash become hyperactive even on normal blood pressure, if it is getting active, so the person will have hypertension. So this is the reason for hypertension in old age, that is known as primary hypertension, that is overactivation of rash. So overactivation of rash, if you want to treat hypertensive, inhibit RAS. How we can inhibit RAS? We can inhibit RAS in three places. What are the three places? Inhibit renin. If you want to treat that hypertension in old age, inhibit renin. So angiotensinogen is will not converted into angiotensin 1. Angiotensin 1 is not converted into angiotensin 2. So it will not on that organ, so blood pressure will not rise. This one is the number one reason. Otherwise, number two, ACE inhibitor, that angiotensin converting enzyme inhibit, we want to inhibit. If you are not inhibiting, okay, here we are not inhibiting this renin, oh, it's okay, inhibit ACE. So ACE, this angiotensin 2 is not formed if you are not inhibiting renin and not inhibiting this ACE also. Third things, we will block that AT receptor. All the six organ having AT receptor, no, we want to block. So if angiotensin 2 at all it, okay, all it, if forming, it cannot act on its receptor. Here AT2 formation is there, but here we block that receptor. So and increasing that blood pressure. So these are the three type of drugs. We want to inhibit renin, otherwise this ACE, otherwise this receptor we want to block. Based on that, we have three type of drugs. So we have three type of drugs: renin inhibitors, then ACE inhibitors, then angiotensin A1 receptor block. So these are the three drugs which inhibit RAS at a three different level. Either inhibit renin, this one number one, then inhibit ACE inhibitor or inhibit this receptor. Okay, receptor means block that six organ having receptor, that one. Most common among, we use that ACE inhibitor and AT1 angiotensin receptor blocker, commonly we are using. Direct renin inhibitor we do not use very commonly. So we will see them one by one. These two things we want to discuss. ACE inhibitor, how many drugs? All drugs that suffix have brill, okay. So captopril, elanapril, lisinopril, then perintopril, ramipril, posinopril, quinopril and tranatolobril. So that sub is having bril. What are the bril? Captobril, ilanabril, lisinobril, brintobril, ramibril, fosinobril, quinonobril, and tranadolabril. So these are the drugs comes under ACE inhibitor. What is the mechanism of action? So basically ACE inhibitor inhibit ACE, angiotensin converting enzyme. So this angiotensin 1 will not converted into angiotensin 2. So this ACE inhibitor angiotensin 1 cannot converted into angiotensin 2. So it will not act on 6 organ. This AG2, that angiotensin not converted means it cannot act on this 6 organ. So it will rise that, it will not rise that blood pressure. Okay, it cannot rise that blood pressure. So blood pressure will fall again. So this is the mechanism. It inhibit ACE. ACE inhibitor inhibit ACE. So angiotensin 2 is not formed. It will not, this one is will not act on 6 organ. So will not rise blood pressure. Blood pressure will fall. This is the mechanism of action. Next, uses. Uses for mnemonic home care makes patient definitely strong. So we will take first letter. H stand for hypertension. Old age hypertension, we can give these drugs because it will give in hypertension angiotensin 2 is not formed and it will not act 6 organ. So blood pressure will not rise, it fall, blood pressure will become normal. So hypertension the first choice of the drugs. C second letter C stand for conjunctive heart failure. In conjunctive heart failure, it is acting on heart also. Now angiotensin 2, what is it doing in the heart? It will increasing that rate, force and contractility, we already known. So it increasing rate, force and contractility of the heart. In conjunctive heart failure, we want to decrease the rate, force and contractility. So here angiotensin 2 is not formed. So it will not increases the rate, force and contractility. It will reduce the rate of force, contractility of the heart. In MI also we can give because it is reducing the rate of force and contractility. In prophylaxis of MI also, so this one prophylaxis of MI also we can give it. For example, there is obese patient having diabetes, high chances having MI in future. So we can give for prophylaxis also after a primary attack of MI. For preventing the secondary attack, we can give it. D stand for diabetic nephropathy and S stand for scleroderma crisis. Scleroderma crisis, because in scleroderma crisis, hypertensive crisis occur. So for preventing that we can use. Next, adverse effect. Captopril, it is the mnemonic. C stand for cough. A stand for angioneurotic edema. What does then AGE inhibit do? ACE inhibitor inhibit ACE. So ACE inhibit is a drugs which inhibit that enzyme ACE. ACE have double role. We knows it have double. We knows this ACE angiotensin converting enzyme having two role, double role. We are inhibiting ACE, want to inhibit angiotensin 1 cannot converted into angiotensin 2. We want to inhibit this process only, this conversion, because patient have hypertensive. You don't angiotensin 2 to be formed, so we don't want to form angiotensin 2. Blood pressure will not rise, so we want this. Our main aim this one only. But if we inhibit this ACE, this bradykinin, okay, this one is inactive product, this conversion also inhibit. Unfortunately, we don't want this block, okay, this block we don't want, this one, but as a side effect it also block. If this will block the conversion, okay, we also block. We want to this block only, but this one also will happen because we are inhibiting ACE. Bradykinin and substance B will not be degraded into bradykinin, and substance B will not converted into inactive product. They will remain as bradykinin and substance B only. So they causes edema, they causes cough, they causes itching, they can causes taste disturbance. So this one become, this also inhibited, so it will causes cough, edema, itching and taste disturbance. So this is the side effect of ACE inhibitors. Cough, angioneurotic edema and itching, these are the bradykinin substance, okay, these are the side effect of bradykinin substances. Then proteinuria, then others, fatigue and headache. Then P stand for potassium increased, that means hyperkalemia condition. Then low blood pressure, first dose, sometimes it decrease that blood pressure. If we want to decrease that blood pressure, we are giving it in hypertensive person, and we want to decrease blood pressure, make it normal, but sometimes it will extensively decreases that blood pressure, and that person will become hypertensive, and a person will have dive and fall down. That is usually first dose hypertension. L stand for low blood pressure. Next, contraindication. PARC is the mnemonic. Never give ACE inhibitor in pregnancy. B stand for pregnancy. A stand for allergy. Never given allergy. Okay, it will cause allergy. Then R stand for renal stenosis and hyperkalemia. Kidney, never give it in renal artery stenosis or single kidney, because here the main thing, the renal artery stenosis, everything depend on that glomerular function, and here if you are give the ACE inhibitor will give fall the glomerular filtration rate, and potassium is hyperkalemia. If that potassium is already raised, never give it, will further increasing that potassium, and the person have hyperkalemia condition. Next, second one is ARB. What are the drugs? The drugs are That ARB means angiotensin receptor blockers. These drugs that suffix certain. Okay, all the drugs suffix having certain. So what are the drugs example? Losartan, Cantisartan, Valsartan, Telmsartan, Irfisartan and Olmesartan. So suffix is sardan. What are the sardan? Losartan, Cantisartan, Valsartan, Delmsartan, Irfisartan and Olmesartan. So receptors are blocked by angiotensin 2 by ARB. So angiotensin 2 is presented in blood. Okay, by it cannot act on receptor. So, presented in blood, but it cannot act on receptor because the receptor are blocked. We are blocking here. So it cannot rise that blood pressure. So blood pressure fall. So although angiotensin 2 is presented, but it cannot show it action because the receptor are blocked. There are ARBs. So what are the advantages of compared to ACE inhibitor? Because if you are inhibiting that secondary side effect, what is so what are the advantage here inhibiting that receptor? So bradykinin and here the secondary side effect bradykinin and substance B not degraded now. Okay, so here not degradation, only this process only affected him, that receptor this only blocked. So this one, this angiotensin 2 presented in blood only. So this conversion not affected. Bradykinin under substance B is not degraded. So this angioneurotic edema, okay, because of this reason only it causes angioneurotic edema, itching, then taste disturbance, cough. Okay, these are the things. So that bradykinin function is smooth, so this one don't causes these kind of things. These are the advantage. So cough, that rashes, itching, then taste disturbance, these are the things not presented. We are using these drugs. So uses similar to ACE only. Then adverse side effect hypotension, hyperkalemia, and this one never due to pregnancy.